Good afternoon, everybody, and welcome to our weekly Q&A with the Family Support Team at the St. Louis Arc. I'm Sharon Spurlock, Senior Director of Family Education, and I think you're going to find today's webinar very interesting. Today we've got with us Joel Perlman, who, like many of you, is an innovative dad who recognized a need and figured out how to solve it for his family and many other families. So he's here today to share with you this really cool software package that you can use to really help organize your family members' supports and communicate about what you need. So, welcome to Joel. Joel, can you introduce yourself and tell our audience a little bit about you and your family and why you're here today?
Yeah, absolutely. Thank you so much, Sharon, for having me. I appreciate it. My name is Joel Perlman. I am married to wife Debbie. We have three children, of which my oldest daughter, Danny, has autism and she's non-speaking. She's also just has a super sweet nature. We are incredibly lucky to have her. And about 5 years ago, Debbie and I were sitting down on the couch and we were talking about kind of worst case scenarios. We're not around anymore. And how would people know how to care for Danny the way we want her care for, keeping her happy and healthy and safe? We were talking about all the little nuances about Danny, all those little quirky OCDs she has, things like Danny loves to play with her iPhone, and she communicates with it. She uses it to listen to music, and it's a trigger for her if it's not charged. So would people know how to keep it charged? If Danny if you see Danny and she doesn't have headphones on, she'll have her fingers in her ears. So she loves to have her headphones. Or Danny, also has epilepsy. She has seizures periodically. And, would someone know how to handle that seizure in an emergency situation, the way that we would need her to? And it was really after this conversation that we decided that we really owed it to Danny to document her life in a way that people would really understand, keeping her happy and healthy and safe. We also felt like we owed it to any future caregivers, so they're not in chaos trying to figure everything out, all the things that we have inside our heads about our children. And finally, we kind of felt like we owed it to ourselves to give us some sense of peace of mind. Um, we believe that, one of the things that happened when we went out there and kind of looked for um, something we could kind of document her life is really didn't find anything that was very intuitive, or easy to use, easy to update, or easy to share. And what we realized is there's really a major gap in our community. Um, and the reason there's a gap is because most of us, if we even take the time to do it, will do a plan in a binder or some sort of paper document. And the problem with those are that they're not easily updatable. They're just not practical. And so what happens is you might spend time doing it, which does sometimes take a decent amount of time, and then you kind of tuck it away, but it just doesn't get updated generally. So you go back to it a few years later and you'll find that most of it is obsolete. And that was really the inspiration around creating the Danny Plan, which is a centralized hub to help consolidate and organize all the information needed to properly care for a loved one with a disability. It is simple, it's secure, it's really easy to update, and it's also easy to share with rotating caregivers and teachers, therapists, doctors, family members, guardians, and friends. And so what started out really almost like an insurance policy has really become this amazing daily tool. Again, to be able to share all that information that we're keeping in our heads and get it out there with our loved ones' support circles, which is what we really want. There's many, many reasons for planning, and have good, productive, practical planning. And I think that's one of the things that the Danny Pan helps with is kind of the practicality of planning. But a few things you might think of, the few things that are going to come up, one of them is care continuity, being able to share this with others so that everybody is doing the same thing for your loved one from a health standpoint, a safety standpoint, or even just a desire how they want things done, right? A productivity standpoint, being able to find things quickly, whether it's information or documents, right? It'll just give us there's a big piece to just our peace of mind that when we are not around or when we're gone completely, that the people out there that are taking over the care of our loved ones have all the information that they need to do it the way that we want it done, or really better yet, the way that our loved one wants it done for them. So I'm going to give you a pretty quick demo today. This is Danny's actual dashboard right here. What you're going to see is we start out with a nice little intro statement up here at the top. Down here, you'll see quite a few tiles about me, key people, medical and therapy, emergency, all the way down to finances, housing, and legal. We also have an add a category. You can add as many categories as you would like. So you can customize the plan to be as unique to your child as you would like. Underneath each of these main categories, you'll see a bunch of subcategories, like most important things to know about me, my likes, my dislikes, strengths. Under key people, we have family, caregivers, and friends. And under medical and therapy, we have medication, insurance, doctors, diagnosis, therapy, and medical equipment. So we have many standard um, subcategories as well. Now, just like main categories, if there's something else you need to add, you can always add a new subcategory. Example of that down below is this is a subcategory my wife added called Danny's Patient Portal or Surgical History. Okay. So let me give you, I'll show you kind of what the input looks like really quick here. If we were going to add, let's say, Danny's likes here, what you'll see is it'll say in the section, list Danny's likes. You have the ability to put the likes in a bullet list, a numbered list, or a narrative. The numbered list is great for prioritization and step-by-step routines. So you can always fill this out in the way that you would like to fill it out. Many of the sections look similar to this. Every section has the ability to have additional info. They all have the ability to add links. So you can add video to show how something is done. You can also add a patient portal. You can add where to buy something specific. All the documents that we get throughout the years, whether it is a medical document, a legal document, financial documents, or government documents, everything can be uploaded into the Danny plan and also shared. You can also upload photos as well. Okay, let me show you what some of the output actually looks like. So once you have this populated, keep in mind this is a web-based application that is extremely mobile friendly. Everything that you can do on the computer, you can do on your phone just as easily. It is not an app. We do that purposely so it can work over all platforms, but it works fantastic on your phone. It's actually where most people will have access to your child's information, including you, right at their fingertips on the phone, sharing whatever information you want with them. So if you had a new caregiver coming in or new person coming in for the day, and maybe the first thing they want to know, they've never dealt with Danny before, and the first thing they want to know is, I wonder what Danny likes to do. They could go on her likes. Danny likes to play with her iPhones, listen to music. Danny likes to walk in nature. From a routine standpoint, we have, again, brand new caregiver coming in and they're going to have to deal with Danny's routines. Think about from a care continuity standpoint, people making sure people are doing things the same way all the time, but also us constantly re-explaining things, constantly having to retrain people. This is an amazing training manual where if someone came in at their fingertips, they could just go step by step and understand how to deal with Danny's morning routine. Open her door at 8:30 and say good morning, go in her room, encourage her to wake up. A toileting routine, a dressing routine, a shower routine, a menses routine, brushing teeth. We also have the ability to add video so we can show how something is done, which I'll give you a quick snapshot preparing Danny's bed for sleep.
So Danny's bed always has a bunch of pillows on it, which is obviously not easy for her to go to sleep with. So I take off all the pillows and I put them in a stack over here on the floor. And I just pile them up really high and I leave her just the main pillows. So I leave her the regular sleep pillows, the ones in the tie-dye and then her regular sleep pillows. And then everything else, all these other decorative pillows, the fluffies and the ones with the words, those all get stacked over here, and she can put them back on her bed in the morning.
So you can see the power of video. People are showing what a seizure looks like, how to soothe a meltdown, or where the pots and pans are. Um, just to make sure, again, care continuity, everybody's doing it exactly the way that you want it done, and the way that your loved one wants it done for themselves. I mentioned documents. Really easy to find any document. You can store any in the Danny Plan accessible from your computer, as well as your phone. I could be out and about. Here's an example of Danny's last IEP. I could be out and about at Target with Debbie, and somebody could say to me, "Hey, I'd love to get a copy of that IEP." And I could say, "Great, give me your email," and I could send that right out from the computer or the phone to them. Now, sharing the plan is really where the power of the plan comes in, right? Because right now we have all this information and we're kind of hoarding it ourselves. And we really want to have it out there for the people who are, who are our support circle to be able, our children support people to be able to kind of deal with them and know them as well as we do. And so you can share a few different ways. You can either print or you can email them a PDF. You're going to do this for people who aren't very tech savvy, or maybe they just prefer to have a printed copy. Maybe they're not in their lives very often. For others who are going to be in their lives often, daily caregivers, family members, um, you're going to go ahead and invite them into the plan. You can select their role down here. A co-administrator would be like a spouse, a guardian. You're going to want to have a couple co-administrators, so have the same exact access as you do to the plan. The rest are generally going to be shared users, where down here you can decide which information do you want to share with this person. So again, if it was my sister, I'd give her everything, including finances and legal. But for a new caregiver, I'm going to give them much less. I'm not going to give them finances and legal. I may over here need to give them medications. You can get really granular, but I don't have to give them all this other information. So you decide which information you want to give them. And then here you can decide what level of access do you want them to have? Do you want them to view it only? Would you like them to add, edit, and delete, be able to make changes? We have a caregiver. She's like family, and she makes quite a few changes for us on a daily basis. Behaviors, likes, dislikes, foods, whatever it happens to be, she's consistently making changes for us. Okay, you can also print the plan. So again, anybody that you want to just give a printed copy to, everybody can have that binder at their fingertips anytime you want. You can always reprint them. Nice thing about the printing is you can create different profiles. Come in here, print a profile, name it, check off the information you want to print. You can save that profile. So anytime you have a new caregiver, you can print off the caregiver profile, teacher and staff profile. Here's one called medications and insurance, print before doctor's appointments. Let me give you a quick snapshot of this is the full plan printed out right here. What you're going to see is all the main categories are going to be in these blue bars. All the subcategories are going to be in bold. Each new main category is going to be in a blue bar at the top of a page. So you're just looking for that new main category, nice and clean and easy, no matter how you want to share it. A couple more things I'll tell you real quick, and then we can take some questions here. You have the ability to set notifications. So if you want to set reminders up for ourselves, for other caregivers, family members, for the individual themselves, if they have the cognitive ability where they have their own phone and you want to set some reminders, really great from an independence standpoint. A couple different ways to set reminders. You can do daily notifications. And again, a great example would be Give Meds, Lamictal, and I could pick the days that this caregiver works. I could pick the time that they get this particular medication, that Danny gets that. And then I can pick either an email or a phone number, and I can have this reminder texted out to them or emailed to them Monday, Wednesday, and Thursday, whatever time we decide. they'll get a message that says give meds, Lamictal. It could be time to brush your teeth, time to leave for work, whatever it happens to be. I have one that I set up to date specific notification. You can also do. I have one called Turn in the Guardian form every year, and I set a reoccurrence 30 days before it's due. But it can also be time to take Danny to the dentist. And I can pick the individual that's taking Danny to the dentist, and they can get the reminder whatever date and time we set for them. We have a shared calendar as well, where anybody who you decide to share with can see kind of the agenda. Everybody has a different color, so they can all see what they're doing with your loved one. And then we also have a journal. The journal has really become a fan favorite. When I talk about a centralized hub, I think that one of the reasons that, not just from us, but the feedback that we get from the people that are part of the Danny Plan community, also some grants and research we've done through Wayne State University, is it really does drive peace of mind. Everything's always in one spot. You got care continuity. You have the ability to find anything you need at any time. You have all the documents in one spot, so you're not making any mistakes. You can clearly find the documents you need when you need them. The journal is another element, which is things that we want to keep track of notes. You can create any type of journal that you want. This is a general update journal. It might be something that you ask your caregiver to give at the end of the day or the end of the week. You can put a title in there. It timestamps and date stamps every journal entry. They can write whatever they want. They could track their time if they would like. They can check this box and they can just email these journal entries right out to us. So we don't have to go into the Danny Plan to even see them. We can get them in our email. The nice thing is you can add any type of journal you want. So if you want to track behaviors, you can make a behaviors journal. Here's one called Dr. Fellows Neurologist. Every time Debbie takes Danny to the neurologist, she does a quick journal entry to say what happened at that appointment, and she can always go back and reference that date and time and those notes. And keep in mind, if you're trying to keep track of, if you're sharing this information with others and you want other people to see it, again, you can easily share it with others. These journals, just like anything else, are also permission-based. So you can have a caregiver's journal, a journal just for your family, a journal just for you and your spouse. However you want to do it, you can create them that way as well. Down here, here's one from MDHHS. Came and did a visit here. Give you a general update here. Danny had a great day today. We went for a coffee at Starbucks. We went on a long walk in nature, went to pickleball. We ate at Chipotle. She took her meds after we ate. And you can always add a picture to any journal entry. You can also add documents if you'd like to, like a receipt that needs to be reimbursed or whatnot would be an example. Keep in mind, you can always export any journal you want. So if you want to track any patterns, like I want to see everything that happened at the neurologist, or I want to track a behavior because we just changed a medication. You can export any journal you want, pick the dates. It'll go into a spreadsheet and you'll be able to track every date and all the different behaviors in one easy spreadsheet. So a really nice way of tracking all the information and or sharing it with others if need be. The last thing I'm going to tell you is after you populate this, and we can talk about how we can help also, you actually get going on the Danny Plan and help you get started on it. Once you have all your information in here and you're sharing it with others, you know where everything is, but they may not. So one of the things that you can do is you can use this little search bar to find anything you need within seconds. So if you're sharing it with a brand new caregiver and they need to know, I wonder what Danny's dressing routine is, they can just type it in and press go, and it's going to take them right there. So anything they need to find, a morning routine, a dressing routine, Danny's favorite foods, whatever it happens to be, it'll pull it right up in the search. You can also do view more detail, and it'll give you more of the routines.
There's a couple questions about family plans. So if a caregiver, maybe an older caregiver, wants one for themselves and for a person with a disability that a sibling can manage, can you bundle any plans?
Yeah, you definitely can. If you look here to the right, you'll see that I have many plans in here. You on the left, bottom left, you can add a plan anytime you want. So that's really easy for you to do. Now, A first plan, just cost-wise, is $99 per year. The second plan right now is $89 a year. We are coming out with a family plan. It's going to be $250 per year. It's for 3 to 5 individuals. And keep in mind, it's a great question because we actually have people who do multiple siblings or multiple kids. They also can do a parent because we have Danny Plan Aging. We also have Danny Plan Life. So some people do their own plan as well. So you could do a whole family. It's not done yet. If you're interested, please reach out to me if you want to reach out to me at Joel P, Joelp, at dannyplan.com, DANIPLAN.com. If you're interested in a family plan, I will give you a code for it. It's going to be done soon, but it's not yet. So I need to give you a code right now so you can get the pricing that I'm telling you about. Otherwise, the first one will be 99, every other one will be 89 after that. So that's kind of the way the pricing works. It's $99 a year. Keep in mind, by the way, you can share with as many people as you want for that same $99. We also have multi-year subscriptions. We have a 5-year subscription, which is $395, a 10-year, which is $695. That's a 20% discount for the 5-year, 30% discount for the 10-year. And we also have a lifetime, which is $1995. So many people from infant up to a child who might be within their, 40 years old might buy the lifetime because they know they want this to be with their child for the rest of their lives.
Yeah, I'm going to just ask a specific question
Yeah.
related to that that's in the list. And they were asking about kind of perpetuity. Once they've entered all this information into the account, is that something that somebody else can take over if they pass away without having to recreate everything?
Yeah, 100%. And that's why what you're going to do when you share the plan with somebody, you're going to want to pick a couple co-administrators. Those co-administrators are going to have the same access as you do to the plan, and they'll be able to take over payment of it. So if for some reason they want to keep it for multiple years, then they can just keep paying for it. Maybe they'll only need it for the year if somebody passed to close everything out, but they might want to keep it forever if they have a lot of legacy stuff in there. For the aging plans and whatnot, we have things like recipes and legacy and things like that. I'll just give you an example. In the aging plan, you know, people save things like this, right? Grandma Rosie's famous chicken noodle soup. So, but absolutely just make sure you pick at least 2 co-administrators.
Somebody asked about the keychain feature, which I'm not sure I know even what that is. They said that it's really a great idea, and they want to know, when you scan the QR code, does that automatically give read-only access to someone? How does it work?
Thank you so much for bringing that up. And one of the reasons I didn't do it is that it literally just launched. We've been working on it for so long. I'm so excited. We launched it last week. And so when you down here, you'll see this little Danny Plan Safe ID. This is the only tile that when you fill it out will be public, meaning you'll want people to have this information if anything happened to your loved one. If you go in here and you buy, right now we're going to have more products. Right now we just have this keychain where this is going to be the QR code will literally be tied to your child and just your child. You can take the keychain. We decided to do a keychain to start because we feel like you can do it on a shoelace. You can do it on a backpack. You can do it around around your neck. There's a lot of different places, but we're going to be coming out with some other features. Now, once you purchase this, that's all included. All you have to do is purchase the keychain, and the tile opens up right away. So it's really for both somebody maybe being lost or any emergency situation. And again, that is all included in the Danny plan.
So somebody's asking for you to kind of explain again, when you're in a hurry, they're thinking about going to the ER, whether it's the parent taking the person to the emergency room or someone else. How can you give an example of how the plan could be put into motion? And I know, being able to share all that medical stuff seems like the most obvious answer.
To answer the question, I think there's multiple ways. If there is an emergency situation, first of all, you have the list of medications that they take. are right on you. You may even, in your documents, you may have all those emergency documents, including the document that says you are allowed to sign for emergency information for your child, right? The document that they ask for if your child's generally over 18, sometimes guardianship paperwork, those type of things. But basically, all the details that they might ask you about history, everything's going to be right at your fingertips. On top of that, using the journal to take notes and reminding, and with dates and times of those type of things of what's happening as new doctors are coming in and out and telling you different things, you can constantly be using the journal for notes and those type of things.
Question about customizable fields. Can I add customizable fields if there's nothing specific? For example, estate planning and funeral home information. When I look at those tiles, I assume that I would drop that into legal, but you did say you could add an entire tile if you want to, right?
Yeah, you can absolutely do that. You can add as many tiles as you would like. It's not going to necessarily customize fields, but when you add a tile, what I had showed you originally, anytime you add a main tile, it's going to be laid out in this fashion right here. So you can use a bullet
Mhm.
list, a number list, or a narrative to put any information you want. You can certainly title it. I think those also have titles on them as well, so you can title it anything you want as well. And keep in mind, by the way, there's many tiles on here that are missing. So an example was you had mentioned funeral. We have an end of life tile in the aging, right? So that has funeral arrangements, obituaries, letters to friends. Keep in mind, it doesn't matter which plan you pick. If you go into manage tiles, all the tiles from all the different plans are available. So if you need the digital tile because maybe your child has a lot of passwords or they're aging or you have an aging parent and you need to, whatever it happens to be, there's hidden tiles here. If you have a pet and you want to put all the pet information, you can move the pet tile from hidden to visible. And in the visible tiles, you can also make it what it is. So Danny's done with school, so I can go ahead and hide this tile now. I'll save it, and now I have a customized, I added pets, and education is gone. So there's quite a few tiles for some of the stuff you're talking about, but if it's not there, you can either add it to your point about estate planning. If you don't see what you want under here, like trust documents, server garden, you can always add a new subcategory real quick and name it estate planning information. And within seconds, you'll have a new subcategory as well.
I think that's what I love about this plan so much. It's so clearly created by a caregiver, by somebody that has done this day in and day out for a while, and it's so intuitive. In other plans, I've found it really awkward to navigate, and I feel like this has got a bunch of built-in information that just makes it really easy. And I think it's really important that you can share as much or as little information as you want with people to protect people's information. So I just really, you guys know I don't often share a lot of materials that cost money, but I think that having a plan like this, we've got a question about having to do updates and add new information. I think the plan may always have new updates added to it, whether Joel's added a new category you haven't thought about, or somebody's getting older and there's something new that you want to add. What makes this unique is that you can you're going to have to do the work either way, whether you make the giant binder or whether you start working on a web-based plan. With a web-based plan, it gives you so much more flexibility about sharing, about organizing, and about not having to go back and recreate the wheel when the information's outdated. You can just open up each tile and update it. So it's going to take work. I'll be honest, I've had a plan for a while and my life has not allowed me to go in and do my personal plan, but it's there and I'll be able to do that when I can make time for it. And this would be a perfect opportunity for those of you who've thought about coming to the St. Louis Arc paper parties. You don't have to come and fill out an application. You could bring your laptop and say, every time the Arc has a paper party, I'm going to come work on the Danny plan and hang out with other people and eat their free food and just have a good time. So we want you to come and do it that way.
I know this could look like it's overwhelming, and Sharon's right. No matter what, at the end of the day, we should all have this information, whether you do it digitally or you do it in a binder. The couple things. One is when you sign up, there's an opportunity to sign up for a free onboarding. We'll help you get going, get you started, and give you a plan to completion. So I think that'll be is really helpful when people kind of show up to that. And we're gonna as you're signing up, it'll ask you to pick a date, one that's convenient for you. I think it'll be really, really helpful for you if you decide to take the free onboarding, and we can really help you get going. And the only thing I want to say, the biggest difference between those binders and the digital is the updating. On the fly, you can change a medication at the doctor's office. You can make notes. You can upload a new document wherever you're at. You can change a food or a behavior. With the anything else, you have to go back to your computer, adjust it, print it, put it in the binder, and it's just not practical. Most of us are never going to do it, so it's never going to be updated. That to me was the gap that I found in our lives, and I felt like
Yeah.
when I went out there, it seemed like it was for most people.
I think almost every time we've ever done a written document, it's outdated by the time it's done, because that's the nature of the world. So we've got somebody who's very focused on that transfer, the legacy transfer, and they're asking about, if probate takes a long time, if a parent passes away and the payment hasn't been made, does the account stay open for a while in case there's a lag with transition? Obviously, the co-administrator still could be in there managing things, but is there a grace period, or how would you support that for a family?
Yeah, I mean, there's a couple things from a timing standpoint. Again, it stays alive for the year if you do the annual, right? Depends when you do it. You're going to have all those months until the renewal comes up. When the renewal comes up, if the person passed, the co-administrator theoretically is responsible for the payment to continue it. So maybe they'll have to pay one more 99, and then they'll have it for one more year, and then they can stop it after that. If for some reason someone lost, like was like, oh, we can't find the password, we can't get in, and we need the information, we'll absolutely work with you to make sure we can get you that information out. You can also, if someone passed, you could print it out. You could put it in a zip file if you'd like to before it renews. Those are some other options. Yeah. But certainly,
Yeah.
if someone didn't renew, we save it generally for about 6 months, the information, just in case. And we're giving people a lot of prods that their plan has not been renewed.
Yeah.
Update your payment. We're letting you know. And usually they're either renewing, or every once in a while someone just says, oh, we're gonna, we'll cancel. Yeah.
I think this was wonderful information for our families. We didn't really talk about this, so if there's one more minute, Jill, are there states where they have added the Danny plan to the state plan for Medicaid waiver? Is there anything in Missouri where they have included this as a fundable resource?
Yeah, there's nothing yet in Missouri. We have in California right now, it's being covered through self-determination here in Michigan, and we're working on a couple other states. I do think over time we're going to get it covered. There's a lot of different, we kind of have a lot of different irons in the fire, but as you guys probably understand from the process of working with the government. Everything's very slow and it takes a long time, and these things aren't easy. But I do think a lot of governments are seeing the value of, and the systems are seeing the value of the Danny Plan, and that it's really a needed thing. So hopefully, eventually, it will be covered. Yeah, thanks for asking. Can I give everybody a discount code too? Would that be okay, Sharon? Okay, great. So if you do decide you want to, if you're interested in becoming a member of the Danny Plan, which we'd love you to join the community, if you go to dannyplan.com, and there's a get started in the right-hand corner, use the code DP25 for 25% off. That's DP25 for 25% off the first year. I always recommend to people, by the way, that if you're interested, get started. I just do that because people procrastinate this stuff, and a lot of times it just keeps going to the bottom of the list. I promise you, you don't have to get started tomorrow. What I tell people is pick a date to do an onboarding, so at least it's on your calendar and get it going. The hardest part is just getting started. But what I do
Yeah.
promise you is if you do a plan, whether you do Danny plan or another plan, it will give you some peace of mind, big time.